thanks for joining us here today. We are in the St. Mary's Health Department, and we are with Miss Tammy. Miss Tammy, how long have you been doing this?
I've been here at the health department for the past 7 years.
7 years. And Miss Taylor?
I have been here at the health department for the past 2 years.
2 years. There you go. And now you can associate the voices with everybody as well, so we get a little background. So when I think of health department, I'm probably not unusual when I think of it's a place to come pick up, medicines and emergencies and things of that nature. But based on our conversation before the mic was turned on, you're way more proactive and have way more things going on than just that.
Yes.
So we'll start with some of the events and things that you do. What are some of the ones that we have coming up, and what are some of the ones that are annual?
Sure. So this Saturday, Saturday, September 14th, from 9 a.m. to 12 in Leonardtown Square, we will be having our 3rd annual Walk for Recovery. We're going to be celebrating folks in the community that are in the recovery journey. This is a family-friendly event. It's free to all community members. Everyone who comes will get a free t-shirt and water bottle while supplies last. We have face painting, rock painting, bubbles, lawn games. We'll have a great DJ. Bring your whole family. We also have over 16 vendors that have education and resources for those in the community to provide. The walk does start at 10 a.m., so please feel free to join us.
Okay, and you do this every year?
Yes, we do this every year. This will be our 3rd annual walk.
3rd annual, okay. And there's always vendors and always the fun going on with it?
Yes, absolutely.
All right. And where is it? Where it's always in the same place?
Yes, for the past 3 years, it's been in Leonardtown Square in that grassy area, kind of between the Rex and Sweet Bay, and the new social building as well.
Okay, awesome. All right, so aside from that one, though, what are some of the other things that we like to do?
So we also, through our Healthy St. Mary's partnership, we have an annual meeting every year. Our focus is aging well, exploring health and resilience through the lifespan. This is our 11th annual meeting, and it's being held on Thursday, September 26th from 8:30 a.m. to 2 p.m. In the Smart Building at the University System of Maryland at Southern Maryland. And that is located at 44219 Airport Road in California, Maryland. And so this year's themes promise exciting sessions and speakers, including the YMCA of the Chesapeake, youth mentoring, keys to senior independence, indoor air quality, and more. And so all community members are invited to attend for free and network with our local health improvement coalition at this event. And there is registration that is now open.
Okay, so you do a lot of in-person stuff like that every year.
Yes.
You also do some collaborations with the schools. I think we were talking about a ribbon event every year.
Yes, I can speak to that. Every year we have Red Ribbon Week that's
Okay.
celebrated in the month of October, from October 23rd to 31st. It is the nation's largest and longest running drug use prevention campaign. And the 2024 theme is Life is a Movie, Film Drug Free.
Cool. Oh, that's
so we
neat.
coordinate with the Director of Safety and Security with St. Mary's County Public Schools, and we try to immerse ourselves in all of St. Mary's County Public Schools, primarily the elementary schools, but we are open to middle schools as well. Last year we were involved in 10 local elementary schools, and we provide things like a Wise Owl meet and greet with one of our staff dresses in the Wise Owl costume. We do drug prevention, substance use prevention assemblies, and we also do lunchtime activities with the prize wheel, and asking some true or false or open-ended questions to really get the kiddos thinking about this.
That's a lot of fun. So is there significance to the red, though? The red to the ribbon? Is there a reason for just its attention?
Sure. I think it's just a color associated
Okay.
with the drug use prevention. Just as purple as you can see, Tammy and I are wearing
Purple, that's
for
right.
September is National Recovery Month, as well as prevention or suicide prevention. So we're wearing purple too.
Gotcha. All right. So we do red ribbon things. We do in-person stuff. You have lots of speakers that come in and out and talk to people as well. And those are always very influential in the community too. So those are really good to show up to. Do you have any favorites? Ones that you're I get super excited. I know you get super excited about all of them, but maybe one a little more excited than others?
So about 2 years ago, we were privileged to have Brandon Novak come, and we collaborated with the College of Southern Maryland, St. Mary's College down in, and he came and spoke at the college, and we are in the process of identifying a new speaker to come
Okay.
down this year. So sometime between now and the end of June to do to
Yeah.
talk about
Yeah.
their recovery. And so whether it's recovery for substance abuse or mental health, because of the focus, that can give that lived experience
Yeah.
and see how that individuals can overcome. And so we had a great turnout with Brandon Novak, and we're hoping, to have then another successful event
Yeah.
in person, and to collaborate with the college again.
It seems like you get put a way more effort into getting somebody that's a little more notoriety, somebody that people have seen. Like you put a lot of time and effort into recruiting somebody that's going to be influential.
Yes.
Yeah. Yeah. Ms. Taylor, do you have a favorite? And you can't use that one. She already used it. She took it off the list. So do you? All right. What do you
I
got?
do have a favorite. So every year on August 31st is International Overdose Awareness Day. So I've been privileged to plan our past two candlelight vigils on August
okay.
31st. So that was about 2 weekends ago. We partnered with Good Samaritan Lutheran Church and Beacon of Hope Pyramid Healthcare. And really, it's just about creating a safe, non-judgmental space where community members can come and grieve their loved ones who passed from substance use. We provide all types of support. This year we partnered with hospice. We had a social worker and a palliative care coordinator there as well. We had some of our certified peer recovery specialists, a part of the behavioral health team that could, chat with somebody one-on-one in a private room need be. We set up a memory walk where you can walk through our tea light candles with your taper candle in hand and really just take a moment of silence to grieve your loved one.
That's a really reflective. That's pretty good. Probably very meditative. Very, very, very good. So, I guess it started this off. I had a certain perception of what you guys do. What is something that you can think of that might surprise the audience? We do that you do that might be beneficial to them. That maybe something they didn't think of.
So one of the things that we do within our behavioral health division is care coordination.
Mm-hmm.
And so any individual for the entire span of life, so children, adolescents, young adults, adults, and older adults, if a family member or individual is struggling with navigating the system for substance use or mental health, they can reach out to us and we can connect them with one of our care coordinators that can provide resources, can also assist them. Oftentimes it's difficult for due to wait list or finding somebody with insurance. Our focal is the public health system, so Medicaid, but we work with any person that needs behavioral health services. So even if they have private insurance, we help get them connected to resources. And we can provide that care coordination up to 3 months approximately. So if they just need an information and referral, we do that. If they need a little bit more assistance with, I've called these providers and I'm not getting called back, we'll, have them come in. We can help with if they want us to attend an appointment or, and help advocate for the different services that they need.
Wow, that's good.
We can really do that. We're also a part of a variety of multidisciplinary teams within our community with our community partners, such as Department of Social Services, Three Oaks Center, our homeless shelter, our sheriff's office, our school board, and where we talk and look at resources that all of us have and how we can support families in whatever needs they have when it's related to behavioral health.
So it sounds more like you're not just there for the quick fix. Like
Correct.
You're there, and if they need help, continued help, you're there to support, especially if they are someone that may not have or may not want to enlist family members or whatnot. They want to keep it to themselves type thing. That's really helpful, and to know that somebody's here for them.
We also have peer support specialists, and those are individuals who have lived experience. So whether it be mental health or substance use. And so if somebody needs that peer support, we also have that availability as well.
That's interesting. Ms. Taylor, what are some of your favorite parts of this job?
My favorite part is really getting out into the community, tabling those community events. We have a lot of events down at St. Mary's College of Maryland. Sometimes we're right across the street of College of Southern Maryland. We're at the national night outs, like I mentioned before. We're in the elementary schools. I just like that face-to-face interactions with folks, really educating them on what we're doing today, what we have to offer, what we do, and then just educating on substance use and the stigma associated with that, as well as our language. And also, we partner with St. Mary's County Public Schools on another initiative. Besides Red Ribbon Week, we do the annual project graduation.
Oh yeah,
which is
Project
in
Grad.
May.
Yep.
So during that, we partner with an outside vendor, and we provide a driving simulator. So
Yes,
the
that's
students
yeah.
are actually getting in our health department vehicles. You can imagine it like VR. There's a screen.
Yep.
They use the actual steering wheel and the gas and brake pedals. And it's supposed to mimic if you were driving intoxicated, either under the influence of alcohol, or we have marijuana goggles. And we survey them pre and post drunk driving simulator. They can, be the driver or the passenger, and it's really interesting, to hear the commentary of them while they're really engaged in the program. It seems to be a really popular thing.
Yeah, it sounds like you have room to be creative in order to reach out to the community in various ways. And that's got to be a fairly fun part of the job, is having a little bit of freedom to be able to access certain things and be more creative. Same question, Tammy. What is some of the things you enjoy most about it?
Some of the things I think I enjoy most are the collaboration and the community support that we have. More recently, at our health hub, we collaborated with the Art Council, and where they did murals on our health hub, and it just was a community event where it was a paint by numbers, and individuals could come and do the painting and help really liven up the building. And so it was just a really neat way to bring attention to services, and so just our just community involvement. We're very involved with providing services, looking at what the needs of our community are, and trying to then find funding and to promote those services.
Yeah, it must be fun meeting all the different people out there. Yeah. We'll take a different direction then. We're going to ask some of the tougher parts of the job. I want to take a moment to at least appreciate what you both and all your department has to go through. What are some of the more difficult things that you have to deal with?
I think some of the difficult is, our philosophy within our division is meeting all individuals where they are, no matter where they are in that continuum. And when we're working with individuals who have had a non-fatal overdose, and we're, our peer recovery specialists are the most amazing people that we have probably as a part of our team, that are working with other individuals that are, maybe continuing to use substances or not seeking mental health treatment. And so, when we're continuously, we do a lot of outreach within our harm reduction program to get information out and services, to making sure that people, if they are continuing to use, that they're doing it safely. But so it's hard to watch individuals, but it's also amazing when the light goes off and they're ready for that next step, and our peers are constantly there to support the various individuals through that process, and then utilizing those other services to get them connected to providers or whatever it is that they are ready for at that time. I think that's it's an amazing kind of process. But it's also really hard.
Yes, draining but rewarding.
Yes,
I'm sure. That's gotta be tough. But yeah, rewarding is seeing them at the very end. And do you ever bump into them like later on down once they've recovered, like see them out and about and just?
Yeah, I mean, we've seen them. We've had peers that have shared, that some individuals maybe was the person that helped them take that next step, and now they're a peer recovery specialist, and that they've seen
full circle.
That person, slip, and it's a cycle, and as it's kind of it's a marathon, right?
Yeah,
It's a
yeah.
sprint, and so there's going to be bumps in the road. But for them just to be supportive and there, and just know that recovery is a disease, and so it's similar to we promote medication assisted treatment, which is similar to if I'm a diabetic and I need insulin. And so wherever, those needs are, we help with that. And so, peers do see them, or if they go into recovery, oftentimes when they come out, they touch base back with that
Yeah.
peer, or, and kind of they're still involved with that. And then, people have then become wanting to then be peer recovery specialists.
That's pretty neat to see that.
And that kind of stuff. And they're able to then help support them and guide them of what it takes and what
Firsthand.
they need to do to become a certified peer recovery
Yeah,
specialist.
that must be awesome to see. So it's coming through, and they had the experience, obviously, so they know what they've been going through.
Yep.
Miss Taylor, the toughest part of your job.
I would say the toughest part of my role, and I think Tammy mentioned it before we started recording, is our overdose fatality review. It's a multidisciplinary team encompassing ourselves and the sheriff's office, MSP, social services, juvenile services, parole and probation. I think you get the point, all of our local agencies. But in that meeting, we focus on reviewing all fatal overdose cases that occur in St. Mary's, as well as those where the individual is a resident of our county but passed in a different jurisdiction. So it's definitely tough when you're reading those incident reports that can be very detailed in the narrative. But on the brighter note, that team is working to make recommendations. We're looking at the coordination of care, where are there gaps in our system, and how can we fill those to prevent future fatal overdoses in St. Mary's County. And part of the OFR, or overdose fatality review, is next of kin interviews. So I'm able to have phone call interviews if the next of kin is willing to speak to me, and really just share the story of their loved one. I do ask them, what do you recommend? What do you hope to see in St. Mary's County? And I've heard things like, how about more grief support groups for youth, especially, when we have 6-year-olds, grieving their parent or something like that. It's really tough. So getting the appropriate resources for individuals of all ages. And then we also have an overdose prevention team that I facilitate. And that team, is primarily the same partners as our overdose fatality review team. And we share best practices, and then we work again to prevent overdoses in St. Mary's County, in which case we do have a strategic plan for overdose response. We just released it a few months ago, and you can check it out on the smchd.org/opioids website. And that plan works to prevent new cases of substance misuse. We're working on our data collection methods, expanding services and supports, really promoting our health hub down in Lexington Park with the crisis walk-in and social determinants of health programs. And that's a plan that we update every 3 years. Its first release came out in 2017, second release came out in 2019. We had a little bit of a delay with the COVID-19 pandemic, as everyone did.
What are you talking about?
But you can check out all of those plans on our website. And when Governor Larry Hogan had initiated in March of 2017 the state of emergency for the opioid epidemic, that's really what spearheaded the strategic plan.
So you said, and a part of that too, you get the feedback from some of the people. Is it like an open feedback loop? Is there some place where people can just like throw ideas and stuff at you too, and you grab them, or is that?
So we have a structured interview question template, but of course, when you're having a conversation, you can always stray away from those questions. But I do really leave it open-ended for them to share whatever they're comfortable sharing with me. And really, how would you like Jane Doe's story to, how would you like them to be remembered? It's not just another number to us. We really try to value them as a person. And then really the biggest part is their recommendations for how we can improve our community and support them on their grief journey, because as you know, it's not linear. So sharing our national, local, and state resources and trying to get them connected to any of our partners that we can.
Where can people use the website? So where can people find more information about maybe attending some of your events or supporting them in some way, maybe is there volunteer opportunities and things as well, or what does that look like?
Sure. So we have a website. It's smchd.org. And then you can go under services, and Behavioral Health Division has a plethora of links that you can click on. Our St. Mary's Go Purple link shares all of our upcoming events related to substance use and stigma. You can also see on the homepage we have a slider that's usually updated with what's currently going on in St. Mary's County. We also have a Facebook, a LinkedIn, and an Instagram page. I believe it's SMCHD GOV, but I can get you the exact
yeah, we'll put it on there
address.
for sure.
But yes, feel free to give us a Google search and you should be able to find it.
And then another way for folks to really get involved is to become part of the Healthy St. Mary's Partnership.
Okay.
So that is a coalition. Currently, we have 4 action teams. We have behavioral health action team. We have chronic disease. We have a chronic environmental health and violent injury and trauma. And so those are our 4 action teams. And we do have a health improvement plan for the county. We do surveys that we get community feedback, and all of that information on when you can sign up to receive notifications of specific meetings, as well as we have a Healthy St. Mary's newsletter that we send out, and individuals can find out more about that through by going to healthystmarys.com.
Okay. Yeah, make sure you jump on your Facebook, the social media, especially because I'm sure you're announcing what you're doing next and things. The stuff you do is a little more creative than I anticipated. I always hear government health department and think it's stuffy, you sit around and not. But you do a lot of events and you do a lot of interactive things and you have way more interactions than I expected. So that's really awesome. Is there any final thoughts? Anything you would like the people to know? Anything that would dissuade people from my picture of what the health department was that they can
I think just our health department is a public health agency, and so we look at what is going around, and looking at how we can address public health issues.
Makes sense.
So we do there's so many different divisions within our health department.
I'm not sure how you guys keep up.
And we're just one of those divisions. Yeah. And so, we do flu vaccines. We have some of those coming up in September and October to help children, making sure that they have all of the vaccines that they need.
Pretty neat.
For school. So we do a lot of things within our community, and we've done bridal shower, baby sprinkles and baby showers, to look at working with we very much do a lot of community work and community outreach across all of our divisions. And so, check out our website for the health department just to see all of the work that we do here, because are so much more than what most people
for example, me, when I started this whole thing, when you guys started talking, like the stuff you do, I didn't expect all this. So way more community involvement than I expected, a lot of more events and things. I need to start paying better attention. That's what it comes down to. So I need to get on your have a wonderful rest of this year, and good luck with the ribbon. Ribbon's next, right?
Yes.
Okay, so good luck with the red ribbon. This may not come out at the time of the walk necessarily, but people should mark it on their calendars for next year, and then the Vigilant and all the other fun stuff that you guys do. So I appreciate your time today.
Thank you.
And good luck for the rest of the year.